Welcome to Community Insight. I am your host, Reverend Dr. Rodney Coles, and we always bring guests on our broadcast to share information. And I tell you, I got a special guest for y'all today here. I have a person, the work that she does. I'm so thanking God for her, and she's going to be explaining what she does. Get your pen and paper out, because it's time again. Welcome to the broadcast, Miss Amy. How are you doing today?
I am doing wonderful. Thank you so much, Reverend Coles, for having me.
All right. Miss Amy, you do a whole lot now. You do a whole lot. So we're going to start out where I know you with an organization, a nonprofit, but let's talk about you first. For then we're going to dive on in.
Okay.
Talk about Miss Amy. Who is Miss Amy?
Well, hello. I am Abby Carter Emanuelson, and I am the current executive director of Care for Carolina. I am. I reside in Cary, North Carolina, but have been the health and disability access and awareness for my whole entire career.
Wow, I'm calling you a different name. Ain't that so? I'm changing your name on the air.
Okay.
You know, but we want to thank you for being on the broadcast. And I know that with the organization called Care for Carolina, you guys do a lot of work there.
Yes. Yes. So Care for Carolina came together about 9 years ago, and for one whole purpose, to help North Carolinians advocate for North Carolina's solution to closing the health insurance coverage gap. And we really worked with our legislature and with residents of North Carolina and advocates of North Carolina to get people health insurance coverage. And just about a year ago, it's been a year since Governor Cooper signed the legislation to expand Medicaid, allowing nearly 600,000 North Carolinians to have access to health insurance through expanded Medicaid.
Wow.
So that's why we came together, and that's what we're doing. We've been actively advocating for the legislation. Now we work through implementation, and now we're really working hard to make sure that all 600,000 North Carolinians that are eligible get the coverage that they have been promised through expanded Medicaid.
I tell you, you think about 600,000, that's a lot of people who, that little piece of income you're missing, that gap, and wasn't ready for coverage. And I tell you, most people don't leave their job because of the insurance, because as we're getting older and we're going to need it for this and this and that. But besides that, just think about the people who was working, they couldn't get it.
Yes, we knew about 75% of those that were eligible for expanded Medicaid were in the workforce. Whether their employer, they just didn't have a job that provided health insurance, or the fact that they worked multiple jobs, a few hours in each, or even multiple hours in each, and they didn't provide health insurance coverage. And so, or they worked small, part-time jobs, gig workers, and those are the folks that have been going without. And those are some of those frontline individuals, those that work in our grocery stores and in our restaurants, and even some nursing aides that just didn't have health insurance coverage, and they were really carrying us through, especially during the pandemic.
You think about the pandemic and thinking about the coverage. My opinion, I would say, a lot of times our emergency room was crowded because if you don't have no insurance, everybody goes to the emergency room. I mean, and it's so packed. I didn't understand it when the time at my emergency room, they had this big TV and they had somebody bringing popcorn and stuff. Because you're there for a few hours. You're there longer than the movie theater. But you just think about it, they have to go somewhere.
They have to go somewhere.
And now that this is out there.
This is out there, and once you enroll in Medicaid, expanded Medicaid, and we are one of those lucky states that as soon as we enrolled, nearly 275,000 North Carolinians had access on day one.
Wow.
And so that meant they had their Medicaid identification, and they had access to a primary care physician, and they were actually they could start accessing affordable coverage for prescription drugs. So that's why we work so hard on Medicaid expansion, is that we could get people access. And part of the way North Carolina is set up is that they get, not only do they get a Medicaid managed care program benefit, they also get an assigned primary care physician when they enroll. And there's plenty of opportunities to, if you have a doctor already, to change. But we believe that the centerpiece of this program is to get a primary care physician so that emergencies can stay in the emergency room and healthcare can be with the primary care providers that know you and know your issues.
It's so good to know that, and they have so many other benefits with the Medicare. I don't know if I can
Go.
add on it. Well,
Yep.
I know that's called Healthy Opportunity, where they're working along with helping with food box and other rents and things like that.
Right.
Having Medicaid, it's probably better having an American Express card right now. Those benefits is out there for people, which is, and the key having a primary care. And I don't know how many people know, because I think in every state now, or at least I know in North Carolina, we have called My Chart. That is the most beautiful thing to have, when you can go and knowing everything,
Yes.
your numbers, knowing your numbers.
Right.
So to speak about some of the benefits
Right.
of having Medicaid.
There's so many resources out there that we know that are available, so many good community organizations, so many state-run programs and local programs that are out there but we just want to coordinate them better. And so just like you mentioned, the Healthy Opportunities Program has been a pilot project for a number of for the last couple of years here in North Carolina, which really helps people not only it's more than just your health. It is it's your housing security, it's your food security, helping with transportation, and those healthy opportunity programs allow people that if they've gotten enrolled in Medicaid to also help get identification that they know about the community resources that are broader than what a lot of us consider as health, but you can't be healthy if you can't make it to the doctor, you don't have a safe house to stay in, and you're not getting good food.
And that is so true. And when you mentioned about those benefits, that people don't realize how much benefit it is behind the Medicaid, but then knowing that no one knows all the work behind the scene. Because I'm going to tell you, me and Reverend Bob, he's that good friend and brother of mine, love him, man. We came one time down to the prayer breakfast, and it was just amazing on the people. There's so many people behind the scenes making this thing happen.
Yes.
Wow.
We had over 200 organizations and thousands of individuals come together just for the advocacy work that we did as an organization. And we were just so thrilled that we could come together and just show the legislature, show the North Carolina General Assembly the support that they had in the public to make this happen. And it was the faith, the farmers, our veterans that are going without health insurance, and young people that just and older adults too that just haven't had access to health insurance coverage, and they've been getting deeper and deeper in medical debt. And we just knew that this was an opportunity to give people a chance. And we're lucky and thankful that the North Carolina legislature, and of course led by our governor and Secretary of Health and Human Services, Cody Kinsley, were able to all come together and make it happen last year.
Well, first, I'm going to say it to you and the organization you work with. Thank you. I want to thank everyone out there who sat there in legislation. Thank you for allowing your heart to move to make this happen. And I want to thank our governor for making it happen, making a point in history that's going to change so many people's life. It's about changing life and making a difference. So I want to thank each and every one of you. I don't know you all by name, but I figure I do in the group chat. Thank you. Now, here's the question I have to ask. There's maybe some people watching this broadcast and want to know, am I able or eligible to get Medicaid?
Yes.
And how would they know if they eligible for this?
Well, that's what we really are trying to get out there. That there are so many people haven't heard that this became available on December 1st. So we really want to share with people how that they may be eligible now. So a lot of people think the traditional Medicaid that most people can get have gotten has been if they meet certain categories: pregnant, young dependents, persons with disabilities, that are low income, very low income seniors. And so but this is a whole new population that are part of the expansion, and it's only income based. So if you are a single individual, man or woman, you can, and you make less than $20,140 a year, you can have, you may be eligible for Medicaid expansion. And then that gradually goes up based on the number of dependents in your house and in your income. So up to, let's see, a family of four, they can make $41,400 or less and still have access to Medicaid expansion.
Now you have an event that's taking place March 18. Let me say the year 2024, so they won't be going to next year, which is a Thursday,
You're so far
a Monday.
advanced. Reverend Coles, you're so far
Yeah.
advanced than
Yeah.
all of us. You're thinking about 2025, while
Woo,
the rest
we
of us
already
are right here.
24, right? And so you have this called covering this. It's getting coverage in the Eastern NC medical enrollment, expanded enrollment event. Could you explain a little bit about that event that's taking place here in Pitt County? And you also have other areas. We get back to that.
Yes, we will. Well, we are. So Care for Carolina, I'll back up just a minute. So Care for Carolina, our sole purpose was to come together for Medicaid expansion. And we promised our funders that if we got Medicaid expansion before our grant funding ran out, that we would turn all of our efforts to pushing out for enrollment efforts and awareness efforts about Medicaid expansion. And so that's what we're doing. We're going to be in existence till the end of May of 2024, and we're just want to make sure that we can make sure that the coalition that came together, the business community, the civic leaders, the faith community, come together in the communities that help make Medicaid expansion happen, so that the promise of Medicaid expansion is realized for all North Carolinians. So Pitt County and some of the other locations were key on where we needed to get to. In this process, it's the center of growth. It's the gateway to the rest of Eastern North Carolina. And so we really wanted to make it a point to be here, to bring together our county officials and our elected officials, as well as the business community. And so having it at Pitt County Community College, it seems like the center of where we want to go. We know that students have gone without health insurance, so that's a key piece of this work, but also the business community that's coming into Eastern North Carolina. We're reaching out to them. So we are having an enrollment event, an awareness event. We're recruiting more vendors. If you're a health and community-based organization, we'd love to have you participate. We have several groups already, including the Department of Social Services Medicaid team, that are going to be there to start the enrollment process about Medicaid expansion. We're going to talk about how to get enrolled. There's so many different ways to get enrolled, but there'll be in-person assisters there that day, and then we'll also have ECU Health COO Brian Floyd is going to speak, Representative Glorstein Brown, myself, Dr. Rouse, and our friend Father Bob Hudak is going to be there to speak and share why expansion is so important to the community.
That's going to be a really good event. I mean, think about on the 18th, that Monday, people could enroll. You don't know the information. If you don't know how to enroll, and you say, well, I don't really know how, I don't know what to do, and all the answers and questions going to be right there. all you do is come out. It's a free event. It's no charge for it.
Free event and free lunch.
Oh,
So
wow.
we're providing meals for everybody that can attend. It's being catered by the community college and Rennell's there right in the center is going to provide box lunches for everyone that comes to our event.
Wow. So you get free lunch as well as getting enrolled at the same time. That's two for one.
And hopefully too, so many connections into the community to make it a healthier, more work friendly and productive event.
Now here's a question. I know that you be leaving us in May. That's what you said is shutting down in May. So
Sunsetting. We're calling it sunsetting.
Sunsetting. So we have a whole big old April, and at least passing Mother's Day and getting to the end before
Yep.
Memorial Day.
Yep.
Here's the question: is there's anybody that say, well, my church or my organization may need some flyers, or somebody to do a virtual call
Yes.
or come to it. But I like virtual call. Easy for me. I love virtual calls. I'm
We
sorry.
know.
I'm sorry. But to do a presentation, would you willing to do that? Because sometimes we could go to an event and there's some
Yeah.
people shy. I know they have these events. We have panels and somebody to speak. Nobody gonna say nothing. But I don't want to get on my business. But I don't mind doing with my pastor. Could you talk to us, explain to us? And that's so much easy to do sometimes. Would you do that for us?
Yes, we are really. I personally got trained to be a Medicaid expansion presenter, so I've got the slides, I've got our information, the local information about how to enroll and why it's important that we get enrolled. I'm happy to share that. I'm especially looking for some of those audiences. We know that nearly 400,000 of North Carolinians have already enrolled, and those last 200,000 we know are probably more rural, just unaware that they might fall in that gap until there's an emergency, and we want to get to people before the emergency. And we know they are probably working, so we want to keep getting our information. And if I can't do it, we have such a good, strong coalition and partnership. We'll make sure that we connect you to somebody else to get the presentation you want, whether it's virtual or in person. We like to travel too.
Well, thank you for that. That's too. I always feel that's so important that they need to have that type of information, and if they could get that information, someone could share with them, it would be so much easier for them to say how we get enrollment done in our church. Because people sometimes they shy, they don't want to come out,
Right.
And I know right now you may, and I want to tell you thank you again because we did those sweet potatoes at 2 different locations, and that was a blessing for those sweet potatoes. But as they was there, I was able to give them the flyers, and so those don't have information on that. They had it right then and there before the potatoes dropped. And Glorstein Brown was with me, by the way, and Bethel. She was with me out there. Then I had Mayor out there in Robinsonville, Mayor Tina Brown. I got 2 Browns, but it was helping me get it out there, get the information. So is there any kind of contact? Now, let me go back a little bit. You having this here on the 18th, but you have other locations,
Right.
just in case you don't want to burn that gas.
Yes, yes. We have. We're also going to head out the next day on the 19th to to Windsor, North Carolina, and have a Bertie and Washington County Get Covered event. Commissioners Ron Wesson and Commissioners Tracy Johnson have been leading that effort out in the East for us to get more people involved. We also have quite a few vendors, some of the same that are going to be here at PCC, but also going to be out there helping people get enrolled and just get more aware of the opportunities that Medicaid expansion can provide.
So let me ask you this here. Now, if somebody was trying to contact you to do an event, how do we do that? How do we get you?
Yeah. Well, you can go to our website, and more information about our events are also on our website at careforcarolina.com. So that's not FOR, but the letter, the number 4. So careforcarolina.com. And my information is there, but I am to email me, it's Abby, ABBY, at careforcarolina.com. And to get more information about our events, it's under our events tab on our website. And all of the resources that we have about the importance of Medicaid expansion to North Carolina and closing the coverage gap are on there too. So if you have questions about, heart disease and access to care, or diabetes or cancer, it's all there too on how we think that the Medicaid expansion can help you by getting the coverage that you need.
Well, Abby, I'm going to say this. I'm going to probably do a meeting with the Eastern Clergy Health Coalition where you're speaking about this year. I'm going to speak with them today. I think we could put a meeting before you leave the sunrise.
I'll be here for you anytime.
Awesome. Well, thank you for that, because I know that so many people listen to this message here today, and they're catching and they're understanding and they're afraid. And I know a young lady that she didn't think she was qualified, and she's working at, I won't call her job out, but she was qualified because she couldn't make, they was taking money from her salary to pay for the insurance. And I'm gonna tell you, the insurance always go up, but not their paychecks. They guarantee that to go up, but she didn't get a raise that year. And she said, I don't know. We started looking at the budget because we had to go over their budgets, with the community insight. We help with their rents and stuff. So the key was she was eligible. She's saving like close to $300 or more a month because she was eligible. And then she get the food box or the part of that. So now she's getting the food box, and you just don't know what you're entitled to. And these folks who have worked very, very hard to make this happen, and so that's why it's so very important. And not putting you in this one, it's very important for you to go out there to vote, because if we don't vote and we don't go out for certain things, we just let things go by the side. And it's very important to vote. I'm nonpartisan, so you don't think that I ain't no party I'm running for. I look for those who's going to make a difference in our community, and that is so important. It's us helping. So the work that you have done and the people behind you, we just want to say thank you. We want to thank you to our governor who made a difference and say, I'm going to push. I know it cannot be easy for him, but you got all those people beating you up, walking around with sticks and stuff with you. It got to be difficult, but it's there. So I'm praying that y'all guys take an opportunity to come out on March 18th. Free food? I mean, come on. Get information. See, I'm going to tell you, money is not power. Knowledge is. Money in the hand of a fool will soon depart. You need knowledge. And this is the knowledge that's going to help you, to help your family, your children. You got medicine that need to be picked up. Medicine is not cheap. They more than anything else in the store. Medicine is very expensive. You probably can buy a Louis Vuitton bag before you get the medicine. These stuff is very expensive. So when we have Medicaid, somebody have worked behind the scene and hard to make this happen, opportunity comes at the door. And it's here. So I'm hoping that y'all come out on March 18th. Come get this information. See where you enrolled. If you a pastor, if you an organization, here somebody will come. Miss Abby will come to you and show you what you need to do. If she don't mind traveling now. So I was trying to pull her back from the traveling, but she don't mind traveling. You know what I'm saying? But if you choose, she could come there, do a virtual meeting if you can. That way you get more people, because some people, they don't want to walk out the house today. But if she's able to do that, get the information and bring it back to your church, bring it back to the people that's around you, bring it back to loved ones. It could be 10 people. Bring somebody together and they're sharing the information. Don't allow them to go without medical, your insurance, things that they need, where they could get free Medicaid and they eligible for it. If you're eligible for it, take it. If you need it, take it. If you don't need it, don't grab something, take it. The popo going to get you. They're going to get you now. I'm going to tell you right now, you don't get away from that stuff. You're doing something wrong. If you need it and is everything lined up, then you'll be approved for something, and you get it and you use it for the time you need for your family. So anything you want to close us out with?
I just want to share too that Care for Carolina has a lot of resources that we're happy to share and push out, as you said. But there's also a lot of information online about enrolling. You can go to medicaid.nc.gov to find out about how to get enrolled if you can't attend our event. And you can also go to healthcare.gov and you can start filling out that form, in the form to get determined if whether or not you're can be eligible for Medicaid expansion. So there's a lot of different opportunities. You can attend our event. You can go visit your Department of Social Services. You can go online to medicaid.nc.gov, or you can go to healthcare.gov for more information. Because
Thank
it's
you.
really key that you get enrolled.
Thank you so much. You have received information. Nobody's stopping you but you to get that. Information is out there. Again, thank you for being on the broadcast, and we look forward to seeing y'all guys again. God bless.